Welcome to The Explainer. When you're talking about early breast cancer, there's one question that really stands above all the others. Has it started to spread? Today, we're going to look at the high-tech way doctors are finding that answer.
This is the single most important question for a patient and their doctor. Seriously, the answer pretty much sets the entire course for treatment for everything that comes next.
So to get that answer, surgeons have a really smart approach. They don't have to check every single lymph node in the area. Instead, they can focus on one very specific, very important target, the sentinel lymph node.
Okay, let's break this down. Think of your body's lymphatic system as a big highway network. If cancer cells decide to leave the original tumor and travel, the sentinel node is like the very first rest stop they're most likely to hit.
So the idea here is actually pretty brilliant. If you check this first guard post and it's all clear, there's an incredibly high chance that cancer hasn't spread any further down the line.
But how in the world do surgeons find this one tiny, specific node? Well, a 2018 study dug into a really cool high-tech method that's designed to do exactly that.
It's a really slick process. They inject a safe radioactive tracer that basically follows the exact same path cancer cells would. It drains right to that first lymph node. Then, a special probe acts like a little Geiger counter, leading the surgeon right to the hot node so they can take it out and test it.
Okay, so that's the theory. The big question is, how well did this technique actually perform in the real world? Let's get right to the findings from this study of 67 patients.
Right off the bat, the headline number looks great. The overall accuracy of the test, its ability to correctly say if lymph nodes had cancer or were clear, was 95.5%. That's really high.
But let's dig a little deeper, into a number called sensitivity. This is super important. It measures how often the test correctly finds cancer when it's actually there. And in this study, it caught the cancer 90% of the time.
But, of course, that leaves the other side of the coin. That 10%, that's the false negative rate. These are the cases where cancer had actually spread, but the test, unfortunately, missed it.
And this is where the real nuance comes in. For a test like this to be the gold standard, the target rate for false negatives is less than 5%. So while the study's 10% rate is good, it didn't quite hit that super high bar set by clinical guidelines.
So what's the final verdict here? When you put all these numbers together, what does it actually mean for people going through treatment?
Well, the researchers themselves wrapped it up by saying that, even with that limitation, the technique is still a valuable and reasonably accurate tool.
And that is the absolute crucial takeaway. This procedure lets doctors personalize treatment. For the vast majority of patients, it means they can safely avoid a much bigger, more invasive surgery that involves removing a lot more lymph nodes, an operation that can have some really significant lifelong side effects. So, yeah, while the science is always pushing to be even better, this test is a huge step forward in making cancer treatment not just smarter, but a whole lot kinder.